Welcome to Washington Hospital Today, dedicated to informing residents about healthcare topics and issues. Through programs featuring community forums and free health and wellness classes, our goal is to empower community members with the information needed to make informed health decisions. Washington Hospital has been providing healthcare to the residents of the Washington Township Healthcare District for the past 60 years. Welcome to today's presentation, Staying Healthy to Retirement, presented by Dr. Jaya Kediyal, Family Medicine with Washington Township Medical Foundation. Dr. Kediyal is board certified in family medicine. She chose family medicine because she enjoys forging long-term partnerships with her patients. Another aspect of family medicine that Dr. Kediyal appreciates is the opportunity of meeting and providing health care to a wide range of ages, oftentimes entire families. Dr. Kediyal's philosophy of care is to treat the whole person, their body, mind, and spirit. Please welcome Dr. Kediyal.
Good afternoon, everyone. Today we'll be discussing and learning how to stay healthy through retirement and beyond. What is healthy aging? Developing and maintaining functional capacity that enables overall well-being as we age is a good definition, as we can see at World Health Organization. Optimal aging includes high level of life, functional capacity, independence, engagement in life without significant disease or disability. And that's what we are going to discuss today, that how as we age we can maintain high functional capacity, independence, without developing significant chronic illnesses and diseases. Pathological aging is low level of functional capacity, low level of independence, where we are more dependent on other people for our daily needs as we age, and poor overall engagement in life with significant diseases. First and foremost, as we are aging, we have to accept aging. We have to accept that we are actually aging. We might feel very healthy. We might be in our 50s, 40s, or 60s, but we have to still understand what aging entails. Decline in function, decline in immunity, decline in sensory sharpness, and much more. But this is very gradual. So we have to become aware that this is actually happening to us slowly. It allows us to prepare for it in an efficacious manner to continue meaningful well-being, because growing old humbly, let's just put it that way, is overrated. We want to keep enjoying and have a meaningful and wholesome life as we age. Aging is often associated with more cell mutations, stiffening of arteries, cholesterol levels tend to rise more easily, loss of muscle mass, bone mass, making us more prone to high blood pressure, diabetes, arthritis, osteoporosis, meaning weak bones, skeleton, and cancers as age advances. I will often have patients and they'll say, I wasn't having blood pressure issue all my life, and now suddenly I'm doing the same thing and my blood pressure is going up. Or I feel this severe fatigue and we have done all these tests, but I still don't feel what I used to feel. Well, this is because we are gradually aging. We have something called deconditioning or fatigue from aging, and people sometimes rest more and it makes it worse. You might have done the same things for maintaining your health in the past, but those same things or those same kind of food and food habits might not be enough this time or as you are aging. The most important thing here is to understand that healthcare is also shifting. We are recognizing that people are living longer and we want them to live longer and more healthier. In the past, we used to manage and treat disabilities and chronic illnesses as they developed. Now we want prevention of development of chronic illnesses and early detection of severe diseases and cancers. The gross factors that can affect aging include lifestyle choices, genetics, environment, mental health, and accidental injuries that can change how you age. The most important cornerstones to healthy aging is sustainable, rewarding, fun physical activity, healthy nutrition, regular preventative screenings, quitting tobacco, substance use, and low alcohol intake, and maintaining optimal weight. Physical activity, 45 minutes, at least 3 times a week. That includes moderately vigorous aerobic exercise, resistance training, where you mix and match. It doesn't have to be boring, it can be fun. I tell my patients some days you can go for jogging, some days you can go for swimming, some days you can do dancing. As long as you are enjoying what you're doing and it's not burdensome. Like her, just self-prioritize your health. Do not, it's great if you have buddies, partners, children who would like to join you in your health endeavors, but make sure they're not breaking your momentum. And prioritize your health, because remember that oxygen mask rule, put it on your face first. There are many benefits of exercising, and I'm sure you know a lot of it, but we'll still go through them real quick. It decreases blood pressure, it decreases blood sugar, it improves immunity, improves sleep, increased lung and heart health, increased bone density and muscle mass, reduces depression and anxiety, helps with weight loss, and breaks cycle of deconditioning and fatigue that we often see and deal with as we age. Before you start exercising, if you have been severely deconditioned or you have risk factors like overweight, obesity, or other health conditions, get approval from your doctor. Make sure that you're stepping into right incremental exercise program. Avoid starting intense, making intense gym regimens, severe goals. Make sustainable goals, make incremental choices, make incremental changes, and that is much likely to make positive long-term impact. Nutrition is very important. You have heard it before, but I'm going to repeat it. Eat fresh, eat seasonal. Vegetables, fruits, whole grains should make a big part of your diet. These are complex carbohydrates. These are the kind of carbohydrates we need. They're rich in fiber, they're low in glycemic index, they're rich in minerals and vitamins, antioxidants, and they make you feel full with fewer calories. This plant-based diet becomes extremely important as we age, because as we age, our hormones change and some of us may gain weight more easily. Lean meats, avoid processed ones like sausages, bacon, and pepperoni. Low-fat dairy is actually recommended. If you're not on a strict vegan diet, then I recommend at least 3 servings of low-fat dairy. It's good for your bone density. It has calcium, vitamin D, and American Health Association recommends it. Healthy fats, monosaturated fats are the fats that sometimes your body cannot make, but they're really heart healthy. Consider olive oil, canola oil, sesame oil, avocado, flax seeds, sunflower seeds, and fatty fishes. Vegetable, fruits, and whole grains. There are multiple researchers that have now proven that plant-based diet, which includes a lot of vegetables, fresh fruits, whole grains, actually reduces your risk of heart attacks, strokes, cardiovascular diseases, heart diseases by 13 to 19%. And it leads to significant improvement in emotional well-being, physical well-being, quality of life, blood sugar levels, blood pressure levels, and cholesterol level. I'm not asking you to become a vegetarian, but I'm asking you to start eating more vegetables and fruits, and not just sticking to certain kinds of fruits and vegetables, creating a variety in your plate. Preventative physicals and age-appropriate screenings are very important. We might not have gone to doctors so often when we are younger, in our 20s, in our 30s even, but we have to realize that as we age, the chances of cancer, the chances of blood pressure, the chances of diabetes, they start in, all these things, the risk factors start increasing. Preventative physicals allows your physicians and your doctors to detect chronic health problems, ailments earlier. We are able to do this age-appropriate screenings for you on timely basis. It will help us make sure that you are not your sugars are normal, you are not running into a thyroid dysfunction, your moods are fine, you do not have any serious ailments. High-risk individuals which are overweight, obese, or have strong family history of certain cancers or cardiovascular diseases, I highly recommend preventative physicals on timely basis. This is a busy slide, but these are the current guidelines of regular cancer screening based on the age. In general, I don't think a lot of people know that breast cancer and colon cancer, only 5 to 10% of breast and colon cancer are actually hereditary or have genetic basis to it. You do not have to have colon cancer in your family or breast cancer in your family to be diagnosed with one. Breast cancer is most common malignancy among women globally. And you can have an idea at age 40, 1 out of 65, age 50, 1 out of 42, age 60, 1 out of 28, and age 70, 1 out of 28 American women is likely to get diagnosed with a breast cancer. Colon cancer screening, now the screening age is 45. It used to be 50 because up to 13% of colon cancers are now diagnosed are below age 50. Mental health is very important. Poor mental health can shorten your lifespan by up to 20 years. It leads to poor quality of life. We might live long, but if we are not mentally healthy, it might not mean much to us. So start paying attention to how your mental health is early on as you're aging. Continue to engage in hobbies, sports, new skills, socialize, learn how to manage stress better. Life is busier for all of us, but learn to see what helps you, what are your happy triggers, how engage in self-care. Outdoors is extremely healing. I highly recommend nature walks, national parks. Meditation is very underrated, but I think very powerful tool and stress buster. Seek support, treatment, counseling if you absolutely need it. Reach out for help sooner. We are here for you. Family is here for you. Let us know when you need help. Also, most importantly, healthy relationships lead to healthy lives. Be mindful of who you are surrounding yourself with, what kind of friends, partners, lifestyle choices you are choosing for yourself. Dementia is a general term for loss of memory, problem solving, and other thinking abilities that are severe enough to interfere with our life and independence as we age. Most common form of dementia is Alzheimer's dementia. 80% of the dementia is actually Alzheimer's. There are other kind of dementias that can happen when people have uncontrolled diabetes, blood pressure, or cardiovascular problems. Dementia is not a single disease. It's actually a collection of symptoms. It's an umbrella of symptoms. One popular myth is that serious mental decline is a normal part of aging. Actually, it's not. Mental decline is not a part of optimal aging. Actually, a lot of 80+ year patients that I see in my practice are very witted, have quick wits and memory and cognition. But over time, some people might age in a way that they have brain cell damage from a variety of diseases, interfering in ability of the brain cells and how they communicate with each other. So their processing, memory, and ability to function independently gets affected. There are risk factors that can make you more prone to dementia, and that would be genetics, high blood pressure, high blood sugars, excess alcohol, tobacco, and obesity. So a majority of it is actually lifestyle choices that you're making. It can dictate whether you, as you age, might or might not get into a situation where you're dealing with dementia. Prevention is physical activity, eating healthier, getting good sleep, quitting tobacco, low alcohol intake, staying mentally active, and socializing. Another popular myth is that, oh, my family members have dementia, Alzheimer's dementia, I'm worried that I will get it too. Actually, only 5% or less dementia is inherited when it comes to Alzheimer's dementia. A lot of people who get Alzheimer's dementia are often the first one to get it in their family, and it is, so all the dementia, 80% of the Alzheimer's dementia we are diagnosing, there is no family history. Good sleep is extremely important. American Heart Association recommends at least 6 to 8 hours of sleep. It improves immunity, it improves your moods, it decreases insulin resistance, it decreases chances of you getting heart diseases, decreased dementia, and obesity. Sleep hygiene is important. As we age, the sleep does become more fragmented. The quality of sleep can get affected, and depending on how you're managing stress, sleep can get affected. Go to bed, try to go to bed at the same time. Set up a schedule. Don't change your timings of sleep often. Avoid caffeine, excess screen time at least 3 hours before your sleep. Avoid exercise at least 3 hours before your sleep. Exercising itself is known to lead to improved sleep, so I would recommend exercising 4 hours before going to bed. Remove electronic devices, and keep a sleep diary if you're struggling with it. Also, if you have mental health issues like depression and anxiety, make sure they're stable. Talk to your doctor if you feel like you go to bed and you have racing thoughts that don't let you sleep. Now we're talking about tobacco. Quitting tobacco is essential as we age. It is a major risk factor to multiple cancers and also cardiovascular diseases. If you quit tobacco, in 3 months your lung function starts improving. In 1 year, your risk of heart attack drops. In 5 years, your risk of stroke is reduced to that of non-smoker. Those are big gains. So ask support, seek support, and make a decision to quit tobacco. Alcohol consumption, I recommend keep it low. We're not expecting people to not indulge, whether it comes to diet, whether it comes to alcohol. But keeping it low or moderate levels is recommended. Per American Heart Association, moderate alcohol consumption is 1 drink per day for women and 1 to 2 drinks per day for men. Drink amount changes based on what you're drinking. But it would be good to know if high blood pressure runs in your family, or you're trying to avoid high blood pressure, or you are pre-hypertensive, that even 1 drink per day is linked to higher blood pressures when compared to non-drinkers. There is no safe level of alcohol intake. I know you are not going to like this, but even moderate alcohol intake, like we discussed previously, leads to up to 1.8 times more risk of head and neck cancers, 1.4 times more risk of voice box cancer, and up to 5 times more risk of esophageal cancer. Colon cancer chances increase by 1.5 times in moderate to heavy drinkers, and the risk of higher breast cancer is also approximately 1.5 times. Last but not least, examine your belief system around aging. What is your inner dialogue about aging or your own health? Do you think you can maintain a good health or not? Do you think you are healthy or not? If it's a negative dialogue, trying to change it. We know that there are multiple variables that affect your aging. It's not just genetics. People who have high blood pressure, who have cancer, diabetes running in their family have been successfully able to avoid it forever or till they're very old. So this all is possible, but it all comes with what you believe about yourself. First thing is to start believing that you can actually make incremental positive changes. Start believing that you can be healthy. Start making incremental sustainable changes. Do not make, I would recommend not making very strong, intense goals. Often people try to make intense goals that are not sustainable. Try to make simple goals. If you're trying to walk, start by saying, okay, I'm going to start walking 10 minutes 3 times a week. Even if you underachieve that goal, still stick to it. Try to stick to it for 3 months. Ask yourself to just do it twice a week. The doctor is asking me to do 3 times a week. I'll start with twice a week. That's okay. People who try to make positive changes eventually will succeed. Only 20% of people succeed in their healthcare goals initially in first try, but people who make such goals are more likely to succeed. Also understand that negative health behaviors are meeting a need. What need are they meeting? Evaluate yourself. I'm eating because I'm bored. I'm eating when I'm sad. You cannot just tell yourself that I'm going to stop doing it. That might not be as successful. You might have to replace it with a healthy behavior. When I am sad, I eat, I will pick up this hobby. I'll keep myself busier. So there has to be an effective positive plan. There has to be effective replacement with a positive behavior. When I crave sugar, I go for baking goods and they have trans fat. What can I do about it? When I crave sugar, I'll have that vanilla Greek yogurt. I'm just giving you examples that you can go by. Expect slip-ups, expect that you will not be able to meet all of those goals immediately, but it's just not, but it's worth trying. It's your health. Make slow, incremental, sustainable changes and be patient with yourself. And if you really need, ask for support and start with, I'm ready to be healthier. This is my photo this year at Yosemite. It was beautiful summer in Yosemite this year, and this concludes my presentation on healthy aging. Any questions?
Yes, thank you, Dr. Kediyal. We do have some questions. The first question is, I take daily vitamins such as vitamin D, C, and B. How do I know if I'm taking the dose that I need?
So most vitamins and multivitamins that we see over the counter come with recommended doses which are okay to be taken daily. In general, I would recommend that you get your vitamins and minerals through supplements, not completely but partially. So take these multivitamins or supplements that you're taking up to 4 to 5 times a week. So that would meet the daily doses, and then try to get rest of it or maybe majority of it through your diet. If you follow the simple plan of taking your supplements 3 to 4 times a week, you should not be overdosing in most of them.
Okay, thank you. The next question we have is, my blood pressure has been in normal range when checked by my doctor. Do I still need to check it at home?
Well, if your blood pressure is in normal range and you do not have regular risk factors or family history of hypertension, then you might be okay with just checking it during your annual physicals. But if you have risk factors like obesity, overweight, family history of hypertension, cardiovascular diseases like stroke, diabetes, then I would recommend that maybe you can check your blood pressure slightly more regularly, like maybe once a month, sporadically. Just avoid taking your blood pressures when you've seen a horror movie or had a not so nice talk with your partner or children, or when you're not returning after a run. So that should work.
That's great advice on the blood pressure. The last question we have is, as I am advancing in age, I am gaining weight more easily, and it's harder to lose weight even when I try to exercise. Why is that?
Yeah, that's a very good question. We have to realize that as we age, the hormones both in men and women and the body composition changes drastically. This happens gradually, but it is happening. Women's hormone estrogen starts dropping, men testosterone starts dropping, we start losing muscle mass, we start gaining more fat. When the hormones start dropping, the fat distribution around the body changes. As we age, the muscle mass starts declining, the bone mass starts declining, and all this leads us to, and all this makes it harder to lose weight. When we have muscle mass, it uses more calorie. The muscle tissue uses more calorie, but fat tissue does not use as much calorie. So you could have been consuming your 3 meals and only doing your exercise 3 times a week, or maybe even not at all, and you were maintaining a good weight because you were generally eating healthy. But the calories have to be adjusted as you age, or exercise has to be increased, because if you don't do that, then hormones will take charge and the fat will take charge and the muscle mass will keep declining. So hormones, decline in muscle mass, these and many other factors lead to easier weight gain as we age. So if you want to maintain your weight or not gain weight as you're aging, it is recommended that you start more regular exercise, strength training, resistance training, mixing and matching exercises, and also looking at your calories in more detail, including more plant-based diet, eating more variety, eating healthier, and cutting down on calories or portions which are not absolutely needed.
Okay, thank you, Dr. Kediyal. This does conclude our program, and we appreciate this insightful presentation from you today. And thank you, viewers, for tuning in. The entire broadcast of today's presentation will be available on our Facebook page and YouTube.